Like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Leatherwood, Marsh, Mitchell, Ramsey, Sherrill, Smith, Terry, Bond, Whitson, and Williams. Mr. Chairman, you have a quorum.
All right, thank you. Before we get into our calendar today, do we have any personal orders? Okay, seeing none, we'll get right into our calendar. Item number 1, House Bill 7. Chairman Zachary, you are recognized. And we have a motion,
Mr. Chairman,
second.
committee. Mr. Chairman, I have an amendment which is drafting code 3975, which will make the bill.
Okay, we have motion a second on drafting code 3975. And please explain.
Thank you, Mr. Chairman. And just quickly for the members that were on the subcommittee, we had a conversation when I left that subcommittee that you would see a streamlined amendment, and that is the streamlined amendment, just for those on the subcommittee that are looking at this bill. Members, quickly, this COVID pandemic has revealed many challenges in many areas across our state. One such challenge is in the 6 independent counties that have their own health department. Some of those counties, 4 specifically, have health boards. The way the code is drafted today, the way TCA 682601 is drafted, it basically provides ultimate authority to those unelected health boards. We've had some real challenges in Knox. I'll stay specific to Knox. We've had real challenges in Knox County with the health board overruling our elected mayor, basically functioning as a legislative and executive body. And so what we've done is we've taken this amendment and we have simply replaced 2 words. We've replaced enforce and adopt with advise. It would simply move these health boards to an advisory role to the county health director and to the county health department. It would simply move them into an advisory role. This has no impact on the power of the health director. The health department has no. There was some earlier drafts that mentioned the county mayor. That's not included in this. We simply move them to an advisory board, as they should be. And the reason it's important that we move them to an advisory role, members, is the way this code is drafted. When this state of emergency ends, when the governor ends this state of emergency, these health boards would have more power in those specific counties than the governor of the state of Tennessee. And that is an imbalance of government. We have 3 branches of government. We do not have a fourth bureaucratic branch of government. The county health director is accountable to the county mayor, who we elect to make those decisions and hire and fire that county health director. And then just let me quickly, before I take questions, I want to just kind of give you a makeup of these health boards. I've got Davidson, I've got Knox here, but again, I'll specifically stick to Knox. And the way the statute is written, these health boards, again, perfect advisory role, a perfect advisory board, because the health board is made up of a pharmacist, a nurse, a dentist, our mayor, a citizen representative, 2 doctors, a vet, and a superintendent. So again, a fantastic board that we need in place. They have certain roles. An advisory role is an extremely important role for this board, but to give this board the ultimate authority in 6 counties is not wise, because again, that is not representation of the people, because we, the people, have no recourse over an unelected board. So with that, I'll be glad to answer any questions.
Okay, do we have questions on the amendment? Okay, Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Chairman Zachary, would you give me some understanding? Would you give me some understanding?
And Representative, I'm sorry, I can't hear you. Could you speak up just a little bit, please?
Would you give me some understanding on how the health board would be more powerful than, I believe you said, the governor when the emergency act is over?
Correct. Yes, sir.
You recognize,
Mr. Chairman, thank you. So legal has told us, based on the 2 words in this code that enforce and adopt that give them their power, it basically gives them ultimate authority in the county related to a health pandemic, a health crisis. And right now, the governor, under a state of emergency, is allowed to suspend any statute or law. So if a health board oversteps their bounds, and a perfect example would be the Knox County Health Board. The Knox County Health Board had put on their agenda and had requested to the governor that he provide them authority in every county that touched Knox County. Well, obviously, that's an egregious overstep. Mayor Frank in Anderson County, Mayor Mitchell in Blount County really rejected that because obviously no surrounding county wants a health board of Knox County impacting decisions that they make. And so that would be an example. And if that were to take place outside of a state of emergency, the governor could no longer step in and stop the health board from taking certain steps, and they would actually be the ultimate authority versus the county health director that works for the county mayor, who would then be responsible for those decisions.
Representative Hakeem?
Thank you, Mr. Chairman. I guess I'm asking the impetus, the necessity for this. Is it at bottom line, is it dealing with whether a person should be required to be vaccinated for the pandemic? What transpired that would make this change necessary?
Yes, sir. Yeah, good question.
Representative Zachary?
Thank you, Chairman. With the various health boards in these counties, and again, only four of the, so you got the big four, Shelby, Davidson, Knox, and Hamilton, and then you've also got Madison and Sullivan, which is Jackson and the Tri-Cities. So only four of the counties have health boards. The Hamilton County is actually the model for this legislation because of the way they function as an advisory board to Mayor Coppinger. But in Madison and in Knox County specifically, there have been some challenges with the health board overruling and issuing orders with a criminal penalty at the objection of an elected mayor, an elected sheriff, an elected law director in Knox County. So the declaration is clear. Government derives its power from the consent of the governed. We elect a legislative branch, we elect an executive branch. And if somebody wants a doctor running the county as their mayor, then a doctor should run, and we should elect that doctor if that's what people choose to do. But in our form of government, we have an executive branch that executes the laws that are passed by the legislative branch. And no unelected bureaucratic board should ever be able to step in and overrule an elected mayor who is the executive of an county and is the head of the executive branch. And that's what's been happening specifically in Knox County and Madison. There's an example of Madison. Chairman Todd would be able to speak to this better than me, but there was a really controversial issue in Madison County that the county commission pushed to the health board because it was politically toxic. They didn't want to make the decision, pushed it to the health board. Then the health board didn't want to make the decision, so then it went back to the county commission. And then the final point, there's a county in the western part of our state that became aware, and Farm Bureau has probably talked to some of you guys about this. There was a county in the western part of our state that had a board. So they are pushing to start their own health board in that county to help to provide some regulation in the county for an issue that is extremely political, but the county commission doesn't want to touch it. So there's consideration about forming a health board for them to be able to make the decisions. Because again, an unelected health board is not accountable to the people.
Thank you very much.
Yes, sir.
Thank you, Mr. Chairman.
Thank you. Any further questions on the amendment? Vice Chair Leatherwood, you're recognized.
Thank you, Mr. Chairman. Let me say I appreciate all the hard work and everybody you've had to deal with and balance out competing ideas and opinions and thoughts on this. So I appreciate the work you've done on this. And I'll confess, I think I like some of the earlier versions better. But to clarify here, with the change in some of the line director or the county health officer both advised the county mayor, so advise the county mayor on the enforcement. Is it your intent that the mayor will actually have authority to approve this enforcement in subsection 2 and actually approve of rules and regulations in subsection 3? Or will he just be in a position of being informed by the health director? Does that make sense?
You're recognized.
Thank you, Chairman. Yes, Representative Leatherwood, it does make sense. So I was really careful, and based on commitments that I made to Chairman Terry, Chairman Ramsey, and Chairman Kumar, as well as the governor's office, I was really specific about the title that we reference here. And I'm only making a change, again, two word changes within 68201 that is related to the health board. So I'm not making any changes to the section of code related to the health director, related to the health department. This is just related to the health board. So the decision-making and hierarchy in these counties will function the exact same ways it does in the state. So the county health director will make the decisions, has all the authority that 68 still gives the county health director, but the county health director ultimately is accountable to the county mayor, who hires and fires that county health director. It's the same hierarchy and decision-making that's here in the state. Commissioner Piercy has incredible authority to take certain steps, but ultimately the governor is the executive of the state, and she is accountable to him. She reports to him. So that would simply, what this bill does, it restores that balance. It removes the health board is this ultimate oligarchy and power within these counties, whether it's being exercised or not. They have that power. All we're doing is removing that, making them an advisory board, but this does nothing to the section of code that affects the power related to the health director or the health department itself.
Okay.
You're recognized.
And earlier versions seem to just deal with a time of pandemic, statewide, state of emergency pandemic, or countywide epidemic. If I understand this now, this would apply year round, year in, year out, year round. Is that
You're recognized.
correct?
Thank you, Mr. Chairman. Yes, I mean, this applies to any current health board or any health board that may be formed, which is, again, one of Farm Bureau's concerns about when the pandemic ends. If additional health boards are formed, this bill's not passed, then they have incredible authority especially in rural communities, to regulate without the executive have any say in that regulation.
Okay. Thank you. Any further questions on the amendment? Okay. Seeing none, we are voting on amendment 3975. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are back on the bill as amended. I have some questions from the members. Representative Clemens, you're recognized.
Thank you, Mr. Chairman, and thank you, sponsor. Understand your concerns on this. You referenced the Farm Bureau a few times. I've spoken to the Farm Bureau, and I think their concerns are on another issue entirely. I don't know if it's tangentially related or not, but I just want to be careful about the Farm Bureau's position there and make sure we're clear on that. And if they want to clarify their, I'm sure they'll come in and do it. But who appoints the Public Health Board?
Chairman Zachary, you're recognized.
Thank you. And thank you for the question about Farm Bureau. I've met with Farm Bureau. Farm Bureau actually has a bill related to the health boards that's really narrow in scope. So their concern is about the power of the health board. I've met with Stefan and the Farm Bureau many times. So thank you for asking that clarifying question. In terms of who appoints the health board, it's the county commission.
And the county,
Representative Clemens.
thank you, Chairman. And the county commission's elected and held accountable to the voters. And so they appoint who they think is most appropriate and qualified to serve on the health board, correct? Is that right?
The county
Chairman?
commission appoints the health board.
And
Representative
generally, here in Nashville, ours is made up of medical health professionals, all of whom are qualified to speak to these types of issues, pandemic-related, health-related, and otherwise. Whereas, somebody like a mayor, whether it be an attorney, a wrestler, somebody else, might not be as qualified. So it seems like we want to remove politics from these important decisions and allow people who are actually qualified to speak to these issues and make a decision in the best interest of public health and welfare, making the decision. Why would we want to take that out of their hands and put it into politics?
Chairman Zachary.
Thank you. And thank you for bringing up the Davidson County Health Board. So I've got the list of the health board here, and I think actually you and I agree on the point that we need the medical professionals making these decisions most equipped to do so. And that's why the health department and the health director in those individual counties need to be the ones making these decisions. And the reason I say that is because the makeup of the health board here in Davidson County, because you had referenced their expertise in dealing with a pandemic. On the health board of Davidson County, you have a psychiatrist, you have a registered nurse, you have an administrator at Vandy, you have a senior director of licensing and certification at a particular company that I won't name, you have an orthopedic surgeon, and then you have a doctor of internal medicine. So you actually have one doctor of internal medicine along with an orthopedic, two administrators, a registered nurse, and a psychiatrist. So while those are fantastic people to be on an advisory board, which is what this bill does, that is not, we don't have a system of government in the United States that allows a fourth branch, an unelected bureaucratic branch of government, to make decisions without recourse from we the people, because we the people elect the county executive. Your health director, my health director, they report directly to the county executive. Now they have incredible leeway based on TCA 68. But you and I agree on the point that the health professionals and those best equipped to make those decisions should be making them. And that's why we're removing the health board as an oligarchy and an ultimate authority in these counties, and making sure that the health director and the health department has that power, which it does if this bill passes.
Clemens, you recognized?
Yeah, I guess my question was, why do we want to insert politics into the equation and not allow those medical professionals who speak to a lot of it? And it's great. The diversity on the Metro Health Board is outstanding, from psychiatry to surgery to any of these administrators. I mean, these all people bring a different perspective, but ultimately appreciation for the public health and welfare and making decisions in that interest. Taking it out of their hands and putting it into, let's say, a mayor who might not have any qualification whatsoever, lawyer or otherwise, seems like we're inserting politics into the equation on a very important decision, such as a pandemic, I think, which is your focus here, or the impetus behind this. So why would we want to do that?
Chairman?
And I think that's where we have this misunderstanding, because this amendment is really clear that this is this moves to an advisory board through the county health director and into the mayor. So we're taking politics out of it, because this board that has become so politically toxic in some of our communities, we're removing them from the process, moving them back to an advisory board, to where if you talk to the health board, which I have multiple constituents on our Knox County Health Board, they have privately told me they were brought on and appointed as an advisory board. The Knox County Health Board website actually had advisory board listed before this pandemic began. We're elected. We're accountable to the people. We represent the people. We knew exactly what we were signing up for. The people on this health board were not elected. They had no idea they would ever be thrust into a position where they would be the ultimate authority in a county, basically issuing orders, mandates, which are effectively law, with a criminal penalty, and be bombarded by we the people, because they are the ultimate authority. So I would say we are removing politics from this and putting this authority back in putting the authority back in the hands of the county health director, because that's exactly what the legislation says. Again, I make no revision or changes to the section of TCA 68 that have the powers of the health director.
Representative Clemens?
Yeah, thank you, Mr. Chairman. I think we have a disagreement in that respect. And you referred to them as an oligarchy and these types of things, and these unelected folks making decisions, but every single day, unelected people make decisions. I mean, we have a administrative regulatory system that makes it a lot of important decisions at the state and local levels. And so I'm a little confused. You keep using this example of we don't want these locals to be more powerful than the governor, but we sat on an ad hoc committee this year with the governor's executive powers, the subject of that. And you and others repeatedly said, we don't want the governor making these decisions. We want local government and local leaders making these decisions. So I just trying to figure out, which is it? What do we want? Or what do you want?
Well, in terms of what we want,
Recognized.
I mean, sorry, Mr. Chairman.
Go ahead.
Okay, yeah, I thought you were telling me to hold on.
No, sure.
In terms of what we want, I mean, you and I probably want two very different things, but in terms of what I want and the intent of this legislation is to ensure that we have a proper balance of government. We have 3 branches of government, not 4. Right now, with this, in the 4 counties that have a health board, we have a 4th branch of government, period.
No more questions?
Thank you. I mean,
Okay.
I don't necessarily
Correct,
know
Council.
that we have or want different things, but I guess my question is, I'm trying to figure out the viewpoint here and what's behind the legislation, because like I said, we spent the all session in this ad hoc committee talking about how powerful or too powerful the governor was. We wanted local control, but now we don't want local control, and you're arguing that the governor should have more power. So I guess that's why I'm trying to wrap my head around it and just figure out what the position is here. So thank you, Mr. Chairman. Appreciate the long leash, and thank you, sponsor.
Thank you. Representative Mitchell, you recognize.
Yeah, thank you, Mr. Chairman. Yeah, I wanted to start out by thanking Dr. Yahanger here in Nashville and Dr. Hildreth. I think they've saved thousands of lives here in Davidson County and probably saved thousands of lives throughout the state by, controlling the spread of the virus at a point in time where I thank God every day they had the authority to do what was necessary when other people in this state sat on their hands and refused to make any decisions or make any political decisions that would hurt a vote, because in a pandemic, it's not about a vote. It's about living and dying. And I think you referred to a minute ago. Did you say we had you have a vet on the Board of Health in Knox County?
Thank you, Mr. Chairman. Yes, a statute, TCA 68, gives the authority for the adoption of a veterinarian on the health board.
Yeah.
You recognize.
Thank you, Mr. Chair. And I think, and you named some other professions on the board, and then you cited a lot of the, people on the Metro Board of Health. Well, do you know what the profession of the state epidemiologist is right now, while we're in the middle of the worst pandemic in 100 years?
Chairman, you recognize.
That doesn't pertain to this bill, so you can tell me. I assume you know.
It's a veterinarian, and we have a pediatrician who is the commissioner of health currently. So I don't know if I would question the credentials of the Metro Health Board, and I think you said the county commission up there appoints, but I would be safe to say that the county mayor probably puts up those nominations, does he not?
Chairman, you recognize.
The nominations can come from the county commission or the mayor.
Okay, so it goes back to judgment, and I think I'll put up with Dr. Yahanger and his decision making and the number of people he saved. I think you said you have a problem primarily with your county, and I think it's the judgment of the people who are appointing the people on the board. I think the folks on Metro that are on the board, they knew what they were getting into. Thank God they knew what they were getting into, and they've done a good job. They've had some other people let them down, maybe on up the ladder. But Metro's done all they can do. So I just feel like you're jeopardizing the health of the citizens of my county by making this political. Again, that's been the problem all along with this pandemic. We've tried to make everything political. Living and dying is not political. This is not political. I mean, it's just not. And things like this really, I think this is the most frustrated I've been in my time in the General Assembly. Science and just basic humanity says, some tough decisions had to be made. And thank God some people stepped up and made some tough decisions in some places in this state, and we're not scared of the masses who may not like tough decisions sometimes. But, sometimes you got to do what's best for folks and not what they like. because, you know, I'm sorry some people didn't get to go out to some restaurants. I'm sorry some people maybe didn't get to go get their hair cut when they wanted to, but we were trying our best to save their lives. And to bring this and to make this political, I'm disturbed by that. So with that being said, go ahead with your bill, but I hope the judgment of this committee sees beyond politics and we do what's right. Thank you.
Thank you, Mr. Chairman, and thank you for your blessing to be able to move forward with my bill. And I think you and I also share some common ground as well. This is also as frustrated as I've been since I've been serving in the General Assembly based on where we are right now.
Representative Smith, you recognized.
Thank you, Chairman Terry, and thank you, Chairman Zachary, for bringing a bill after talking. I know that our county mayor has indeed blessed this bill, if we're using that terminology. But what we are witnessing is not just a crisis of health, but people's livelihoods have been at stake. And while there might be an effort to frame this as political, we are yet again yielding to the false belief that we can't have our prosperity, that we can't have our public health, and that we can't have our liberty simultaneously. It just takes us working together. So I want to thank you and commend you for a very good bill, and I will be supporting this. And thank you that you chose Hamilton County to serve as a model. Thank you, Mr. Chairman.
Thank you. Chairman Boyd, you recognize.
Thank you, Mr. Chairman. I move previous question.
Question has been called. Without objection, we will be voting on House Bill 7 as amended. All those in favor say aye. Aye. Opposed? No. Ayes have it. Bill moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 2, House Bill 215. Chairman Curcio, you are recognized. You have
Thank you,
a
Mr.
motion and
Chairman.
a second.
Thank you, Mr. Chairman. Thank you, committee. Members, I would be remiss if I did not start by saying that this is a piece of legislation before you that passed the House 98-0 last year. So I've been told to lead with that. But there are a lot of other great things that happened in this bill. This is the SAFE Act. And what we're doing here is we are creating some standards, some encouragement for sober living homes to adhere to national accreditation standards. And it was something I began work on as a freshman. This was one of the first bills that I carried, was to create the original SAFE Act. What this does is this comes back and it expands upon it, and provides a much safer, I believe, will provide for a much safer recovery environment for folks after they've left a licensed residential treatment facility, or if they've gone to one or not. But if they go into what we typically call a halfway house or a sober living home, we want to make sure that those folks are not being taken advantage of and going into what's called a flop house. Okay. So we want to make sure that these folks are going into a home that is actually adhering to best practices, that has the best interest of those folks who are in recovery in mind. So with that, I'd be happy to answer any questions.
Any questions on the bill? Seeing none, we will be voting on House Bill 215. All those in favor say aye. Aye. Opposed? Ayes have it. Bill moves on to calendar and rules.
Thank you, Chairman. Thank you, committee.
All right, that brings us to item number 3. And now there she is. Chairman Rudder, I think, will be presenting House Bill 81. You have a motion and a second. You have a motion and a second. Yeah.
Thank you, Mr. Chairman. This is an administration bill. This legislation will increase efficiencies within the Department of Mental Health and Substance Abuse Services by aligning the statute with department practices. For that, I'll take any questions.
Okay. Any questions on the bill? Seeing none, we are voting on House Bill 81. All those in favor say aye. Opposed? Ayes have it. The bill will move on to calendar and rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 4, Bill 13. Chairman Hulsey, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman, and thank you, committee, and thank you for your patience. I understand there's another amendment that's proposed on my bill, and before you vote on it, I would like to argue against it. This bill's traveling with another amendment that came from the subcommittee.
Okay.
And-
we're going to have to put that on the bill in this committee as well. So if you want to present your bill,
I'm sorry.
yeah, you have motion and second on the bill. Okay.
I missed it. What am I missing?
So, Chairman,
Your amendment? Okay.
Chairman, as the bill is right now, we would have to put the amendment that came out of subcommittee back on the bill. So if you want to present your bill before it's amended, you may do that.
Okay, I wasn't going to try to address the First Amendment that pulled out the 44 hospitals or institutions that are owned by government. I wasn't going to argue on that. There's a new amendment. I understand that.
There are two new amendments.
Two new amendments, okay.
So do you not want to discuss your bill unamended?
I can.
Okay.
Okay,
Please.
the bill's pretty simple and pretty short. It just says that state government and local government cannot force somebody or require somebody to receive a COVID-19 vaccine against their will. It does not apply to private business. This is state government and local government, and that's the bill.
Any questions on the bill as it is? Okay. President Clemens, you're recognized.
Is my understanding correct that this specifically applies to COVID-19 vaccine only?
Chairman, you're recognized.
That is correct.
Clemens, you're recognized.
I am not aware of any law or bill or movement to force anyone to take a COVID-19 vaccine in the state of Tennessee. So is your bill necessary?
Chairman, you're recognized.
Thank you for the question. In the subcommittee, we talked about this, and the point of the bill is there's lots of folks out here in Tennessee that are afraid that once this gets approval from the FDA, it will not be a voluntary thing. It will be a forced thing. Now, whether that's true or not, I don't know, but there are a lot of folks who are very afraid of it. And so the purpose of the bill was twofold: to try and assuage some of that fear and to carve out just a little piece of constitutional integrity with it.
Representative Clemens.
Thank you, Mr. Chairman. I think this appears to be, and I understand and I appreciate your position on this, and I understand the fears of some across the state of Tennessee in this regard. But right now, I see this as a problem that doesn't exist that we're trying to solve before the problem even arises. So, I think if a push were to be made after FDA approval or further action at the federal level, taking this bill up at that time would be maybe appropriate. But right now, it seems a bit premature. But with that, I appreciate it. And if you have any comments, I'd appreciate it. Thank you.
Chairman.
Thank you, and you are correct. It is preventive on the front end.
Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Chairman Halsey, I'm over here. There's a word in the bill that I guess I need some clarity on when we talk about coercion. What I'm getting at is that if the governor or someone does a public service announcement suggesting people get the vaccine, would that be considered coercion? I guess I'm trying to get what we would see as coercion when it comes to this legislation.
Chairman Halsey.
Thank you for the question. The intent of the bill is force. Now, when it uses the word coercion, it lines up with force. This doesn't apply to a company who says, we would like to provide an incentive for people to take this vaccine. It doesn't apply to that at all. This deals in the venue of force.
Thank you, sir.
Any further questions? Okay. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. And Representative Halsey, I believe you're trying to do what you think is best for people's rights and liberties, but I just got a question for you. So these new variants that are coming down the pike, let's say one of those just starts running rampant through the society.
I'm sorry, could you talk up just a little bit? I can't hear
I
you.
said just one of the new variants of COVID-19 starts running rampant through society. And I mean, health experts deem it necessary, kind of like smallpox at the turn of the century, that everyone has to be vaccinated for the good of public health. Wouldn't you hate that we've got this on the books that's going to hinder saving a lot of lives? Because I don't know if you're familiar with it or not. The Supreme Court ruled in Jacobson versus Massachusetts in 1905. It created something that the Supreme Court still uses today. It's called the reasonableness test. And a reasonable test is the government had the authority to pass laws that restricted individual liberty if those restrictions, including the punishment for violating them, were found by the court to be a reasonable means for achieving a public good. So my concern is I don't see a problem with an exemption for few. And like Representative Clemens said, they're exempted. No one's going to force anybody right now that doesn't want it. But I'm just scared if we pass your bill that we could get in a situation where we've got this law on the books and it gets to the point where we have to, just for the good of all. What do we do? What do we do with these people that, your bill affects? Do we just quarantine them in a certain area until we get over a pandemic? That's my question, and I'm truly asking.
And I appreciate the question. I think at that time, the legislature probably could overrun my bill and vote in a new one and take that bill away. I suspect this focuses on the sovereignty and autonomy of an individual rather than the sovereignty of a state to force. And in my mind, the Constitution bears out that kind of sovereignty and that kind of right. Since that law, by the way, the Nuremberg Code that America signed on to says that no human being can be used in any kind of a medical experiment. And at this point right now, this is a brand new vaccine, it's never been tried before. And I think the Nuremberg Code that we signed on to and endorsed would trump that first ruling.
Representative Mitchell.
Yeah, thank you, Mr. Chairman. No, in fact, courts as of recent as last year have used this landmark case as a standard for their ruling in several of the lockdowns. I would hate to wait on the General Assembly or the governor. I mean, we can't get decisions on a mask, much less a vaccine to save people. Representative, I think sometimes, less is more. You're the conservative in this. Putting another law on the books just to put something else in the green books may not be the best for the public as a whole in this situation. Right now, nobody's going to force anybody to get this vaccine. That's about 20 years in the making. The science behind this is about 20 years old and coming to this point to be able to come up with this, because there were other viruses that's similar using the same type proteins that this vaccine, is made of. So again, I think we should think long and hard before we put another hindrance on saving lives. the Supreme Court has said this is not an infringement upon anybody's liberty to save the public, as a whole, i.e. the smallpox pandemic. And then they had the Spanish flu right after that, 15 years after that. And now we're in this pandemic. I just think we're going down a bad road. This is the health committee. We're supposed to be looking out for the health of the citizens of Tennessee. And we're 0 for 1 so far today. I hope we're not 0 for 2. Thank you.
Chairman, you're recognized.
I can only saying this is preventive. The whole purpose is what I said before, that there are a lot of people afraid of this. And I'm trying to try and stop that. Liberty in the sense of restricting movement for quarantines to me is quite different than a forced medical procedure that someone doesn't want.
Representative Hall, you recognize?
Thank you, Mr. Chairman. Chairman Halsey, I appreciate you bringing this bill. I think it's some strong legislation, and I like it in its original form. And I think that you should present it with no apologies, because to amend it, it waters down the intent. And eventually we keep whittling away at it, and it's losing what it's intended to do. This is more than about an experimental untested vaccine. This is about the freedom of every Tennessean in this state. This allows every Tennessean to choose their own destiny. And it should be between them, God, and their physician on which kind of medical care or health care they choose or the lack of. I like your legislation. I like it in its original form, and it has my support. Thank you, sir.
Chairman?
I was going to cover some other things when we begin to discuss this second amendment.
Okay. Chairman Kumar, you recognize?
Thank you, Mr. Chairman. Then I will wait until we discuss the amendment to make my remarks.
All right. Representative Alexander?
Thank you, Representative Halsey. I like your bill in its original form. I totally agree with you. To disagree with our representative here, there's a big difference between forcing someone to give their child a vaccine that has not been tested, or a person who is ill that feels it's not safe for them to take it. But it is about, and I agree with Representative over here, it is about our individual liberties and our rights to choose what is best for our families, for our persons, and not be forced to take a vaccine we do not want to take. Thank you very much for this.
Thank you.
Thank you. Any comments? You good?
No.
Okay. Before we get to the amendments, I do want to make a comment before we get to those amendments. I do appreciate you bringing this bill. As I said in subcommittee, I have taken the vaccine. I think I might have been one of the first legislators, if not the first legislator, to get both doses. That was a personal choice between me, my family, my doctor. I've researched all that. I view this as kind of a glorified right to try, in that you have the right to try and you have the right not to try. And so I do appreciate this bill, and I do like the bill in the current form, unamended. So with that, we do have an amendment that came out of the subcommittee, Amendment 3720. I believe that was Chairman Ramsey that has that amendment.
And thank you, Mr. Chairman. Upon the filing of this bill, the Tennessee Hospital Association.
I need a motion and a second. Okay, you have a motion and a second.
Had come to me, and they asked me to establish the intent of the bill from the sponsor, being the intent to prevent any government hospital from requiring COVID vaccine, even though medical and religious exemptions are always available to those employees by the federal law. And we established that was the intent of the bill. We have 45 government hospitals across the state. One's in my district. We depend on them. Typically, they're one of the fourth or fifth biggest employers in a community. They are essential in recruitment of industry and issues like that. So my responsibility is to listen to their requirements, and they asked me to offer this amendment to exempt those 45 government hospitals from the bill. So I have other discussions from the Hospital Association, but I'll await any questions that we have on that.
Okay. Do we have any questions on this amendment? I do have some clarification I would like to get from our council here. I believe that this amendment goes beyond just the hospitals, and I would like clarification from Matt King on that.
Chairman Terry, the amendment speaks to a healthcare facility, and it defines a healthcare facility as an institution, place, or building that provides healthcare services and is required to be licensed under this title or Title 33. And so it does not speak only to hospitals. It would speak to any healthcare facility that would fall within that definition.
So for clarification, that could be a health department in a county.
It could be, yes, sir.
Thank you. Chairman, you recognize.
Thank you, Mr. Chairman. Either it's a government hospital or it's a private hospital. My bill doesn't address private hospitals, so I can't do anything about that. This deals with government, state government, and local government. So I don't like amending out these 44, 45 hospitals because in my mind, you're saying the employees who work at those hospitals don't have a choice about their own personal sovereignty, and they can be forced to take this vaccine. I don't like that. But other hospitals that are outside of government purview, I don't have any control over with this bill.
Thank you. Chairman Kumar, you recognize.
Thank you, Mr. Chairman. Thank you, Chairman Halsey. We had a long discussion in the subcommittee. Looking at the situation at this time, do you see the situation that an employee of a hospital or a nursing home who, exercising his right of liberty, does not take the vaccination and comes to work, and they happen to get exposed on the outside, do you see the risk that they would bring the virus into the facility and make other vulnerable people sick?
Chairman Kumar, are you directing that to Chairman Halsey or to the sponsor of the amendment?
I'm directing it to Chairman Halsey, and it has to do with his effort to not adopt this amendment and not to exclude the hospitals.
Chairman Halsey, would you like to respond?
I will just tell you, my father is 96 years old. My mother's 92 years old. They live in assisted living. Since this whole mess started, that assisted living place has been very, very diligent about testing all the staff, all the nurses, all the workers who work in this assisted living. They haven't had any problems at all. To me, the diligence on that side pays off. The liberty that we're talking about, to me, far outweighs rules or regulations or attempts to force somebody to take a vaccine. And when we get on the other amendment, I'll try and be a little more verbose about that. But I think there's other ways to accommodate people, like the EEOC recommends, reasonable accommodation. I think there's other ways to help folks who really have a conviction about this and they really don't want it.
Well, thank you. Verbose does not overcome the reality of things. And experience in one nursing home and I am grateful that your parents so well, and there were people very diligent there. But that cannot be, I submit to you, that cannot be replicated in all facilities, as many facilities that we have. And I think I'm surprised that you would not acknowledge the fact that with this bill or amendment, with the concept that a person has the liberty to not take a vaccination and yet go to work at a place where there are vulnerable people there. I don't know how we can walk away from it. How you can walk away from it, that's a reality. I don't think the example of one nursing home where the problem did not occur means that it's not going to occur in others. And you know it's going to occur. It's been a terrible pandemic.
You have, yes.
Chairman, you're recognized.
I'm sorry.
You're recognized.
And there has been, and it's awful. I just went to a funeral recently of a lifetime friend of mine whose kids play with my kids, went to church for years and died of COVID. I don't like losing one person, and I can't negate that. I'm just saying that an individual's liberty and autonomy that's guaranteed by the Constitution in this state, to me, trumps a force issue from somebody who works at any facility.
Chairman Kumar.
Well, I think you're very courageous. Your convictions are very deep and great, and I respect you for that. But I don't think we should sacrifice anybody at the altar of our own personal liberty. And yesterday, I think, or day before this mixed by, I gave an example or the fact that every bill that we pass, at the end of it, the last sentence is, this bill will become law on this day, public welfare requiring it. Those words, public welfare requiring it, in this situation, we are going to change them to my personal quest for liberty requiring it. Because when it comes to public welfare, sincerely, it's allowing people who are a potential risk to walk into these facilities. That is not public welfare. Allowing a person who is not properly protected and vaccinated to work in that area and then go out into the public and into their own family and neighborhood and church, that is not public welfare. So it's a balance between public welfare and my own personal quest for liberty. And I still remember Barry Goldwater's admonition that extremism in defense of liberty is no vice. But still, in this situation, by the way, that election was lost terribly. But coming back to this, public welfare is what we are here to do. And I think in this situation, to interfere with public welfare. Thank you, Mr. Chairman.
Thank you. Chairman Halsey?
No, I don't have anything.
Anything? Chairman Ramsey, you recognized.
And I just want to make clear that don't misunderstand. This is employees. This is not patients. This is not people that are in residence in nursing homes. And the hospital employees, were they required to get vaccinated? Most of the hospitals, or all the hospitals, would certainly honor the medical and religious exemptions that are offered federally, and most of them would make efforts to make these people that didn't want to take it wear personal protective equipment or work in additional areas or have some other alternative, but they just want the right to do this for their employees only.
Thank you. Before we have some more members that do have some questions, I want some more clarification from our council on this as it talks to employees or to person, and then secondly, as this relates to departments, the Department of Health buildings, and whether or not they can promulgate rules based on the way this amendment is written.
Chairman, the way the Amendment 3720 is structured, It begins with in subsection A. Subsection A is essentially a repeat of what is in the original bill. It is that preemptive prohibition on state and local government from forcing, coercing, or requiring a person to receive the COVID immunization. That is what essentially is subsection A. It then creates an exception within subsection B. That exception is for healthcare facilities as defined, which is what we spoke about a moment ago. Because it functions a carve out from a prohibition, that means that now where the way the amendment functions, if it were to go on the bill, is that instead of being prohibited from forcing, requiring, or coercing a person to receive an immunization or vaccination for COVID-19, in the context of a healthcare facility, the government would still be able to do that. So I hope I'm being clear, but in that context, it speaks to person. So that could be any person. And it would be the ability of the government to speak to healthcare facilities in the context of the COVID-19 vaccination and requiring that.
And so to be clear, the government could say if there's a patient in a government-owned hospital facility, the government could say they could get the vaccine or could require them to get the vaccine based on how this amendment is worded.
That's correct. The government, these entities would be able to, through their normal authority to promulgate a rule, issue an executive order, however, whatever mode that may take, they would still have that authority within the context of healthcare facilities as defined in the exception.
All right. Thank you. Representative Freeman, you're recognized.
Thank you, Chairman. And Chairman, thank you again for the explanation of this. And I feel like we keep getting twisted up under the forcing versus requiring and talking about individual liberty versus liberty for the greater good. And I guess I just go back to, and Chairman Kumar made the comment, I don't think anybody's going to hold somebody down and force them to get a shot. And that's kind of the idea that I keep hearing. But I do believe that many of the people in their businesses or industries in these three amendments should have the right to require their employees, if they choose to continue to work there, which is their choice. They do have the liberty to decide to work at a different facility or let the market choose where they want to work based on the working conditions. But I do believe that an industry should have the right to set the conditions in which that job needs to be done. And if they believe that to protect a vulnerable populace, that they want their employees to get vaccinated so they can't spread it, I think they should do it. I don't think they can require and hold down their employees to do it. Those people have a right to find another job. And again, I just think we keep getting twisted up on the forcing versus requiring. And anyway, that's my comment.
Chairman Williams, you're recognized.
I'm so confused now. I don't even know who to ask the question to, but I guess I represent a district that has a governmental-owned hospital. I heard from the CEO of my hospital. I know that they have these frontline workers were some of the first to be able to get vaccines. And distribute those in my community, but the hospital never required people to do it. They made it permissible. My fear is, and came in here in full support of the amendment, the 4 or 5 hospitals, but now I'm hearing it could be a wide range of medical facilities. And so in my community, we had law enforcement, 27% took the vaccine. It was permissible. EMTs was 31%, was permissible. Hospital employees, I don't know what the percentage was, but I know quite a few that didn't take the vaccine. So under what my good friend and colleague said there, he's saying, go find another job if you're not willing to take this vaccine. That just doesn't make sense. I really don't understand why we would require someone to do that in a community where they've worked and lived for decades. And so although I want to find a way back to permissivity, which is also liberty, and I don't know that this amendment would actually allow for permissivity based upon what legal has now deemed it to be. And so, as much as I came in here in support of my fellow colleague and the concerns that he had, my fear is that we do, in fact, take away a person's individual liberty to decide where they want to do. And quite frankly, if we don't do it, they could lose their job. Whereas this is not the current common practice among these hospitals or governmental entities anyways. And so I guess I'm going on the record for my community back home, but it concerns me that this amendment goes way further than I expected it to as of yesterday. And so I won't be supporting the amendment.
Chairman Ramsey? Yep. Do you have any response?
Oh, any response? No, I honor the representative's feeling. And as far as patients, we have a patient's Bill of Rights here in Tennessee that they can do anything they want to, check themselves out or refuse anything in a hospital. I've seen it happen too many times. So as far as patients being corralled, but in the past, I think even in flu epidemics, there have been some suggestions. I know one particular person that works in research at Vanderbilt that all of their staff there is required to have vaccinations for flu because they work around so many dangerous microbes that they, if anybody gets sick, they have to test them for everything under the sun. So, I trust the feeling that the hospital is responsible for the health care of everybody that comes in there. And it's their opinion that they want this option in the future.
Chairman Halsey?
Yes, it's a great point. If we say nobody's requiring it, and then why do we have an amendment to exempt hospitals out of it unless there's a plan or they look down the road and say, I might want to force it at some point. It's a great point.
Okay. Any further questions on the amendment? Okay. Seeing none, we will be voting on Amendment 3720. All those in favor say aye. Aye. Opposed? No. Ayes have it. We are back on the bill as amended. We have a second amendment, amendment number 4084. Representative Kumar, you're recognized.
Thank you, Mr. Chairman. Members, this amendment is along similar lines in the subcommittee as the amendment to exempt the hospital and healthcare facilities passed. It is a natural say that when we look at, let us say, corrections facilities that are quite filled with COVID patients, it has spread very rapidly there. And if an employee or corrections officer from the outside goes into that facility and he does not take the vaccination, he can contract COVID and bring it out into the community and to his family. Similarly, in schools, the same option applies, or same concept applies, that if a school worker, be an educator or other services, does go in and brings COVID from the outside, they will spread it. It is true that children handle it well, but children can be carriers of the COVID virus. So again, it is to protect public. It is for public good that we
we need a motion, a second on this. Okay. Yeah, you have a motion, second.
Thank you. I think I've explained it in the fact that, again, it is to protect public. It is to protect the spread of COVID virus. And it is certainly to ask the employees, which again, Tennesseans have done well and done the right thing, but there may be a need for the hospital, just like a private facility or a school or a corrections facility, to require that the employees protect themselves, thereby protecting the public and their families. With that, Mr. Chairman, I move to adopt the amendment. Thank you.
Do we have questions on 4084? Chairman Halsey, you're recognized.
Yes, am I mistaken here, or is there just two amendments? The one that Chairman Ramsey had that came out of subcommittee, and just one more, this one?
There are two extra amendments. There are three that have been filed on this bill. One that came out of the subcommittee and two by Chairman Kumar.
Okay, can I speak to this one?
Yes.
All right, we already carved out in the other amendment to exempt all these hospitals. Now you want to exempt school teachers and be able to make them take it. You want to exempt corrections people, make them take it. And police officers, I'm assuming, make them take it. Which it's kind of amazing to me because school teachers are some of the most folks who have called me or emailed me from all over this state, some of them from your district. As a matter of fact, 3 days ago.
Chairman, for clarification, this bill does not, or this amendment just is public schools and not law enforcement.
Okay, not
Right.
law enforcement,
Yeah.
it's on another
That's a
one,
different
all right. Teachers emailed me, and 3 days ago, one of them emailed me and said, some of us want to know if you can pass this bill, when it'll be in effect. Because we want to know if we've got enough sick time, vacation time, and comp time to stretch this out, because we're afraid that our school system is going to try and force us to take this vaccine. That's a terrible position to put school teachers in. And it's interesting to me, too, that the justification for the First Amendment is that we're dealing with people who are vulnerable and in an institution and sick, and you don't want to make them sicker. Now we have moved to school teachers who are well people, who are going into classrooms with well kids, and nobody would think of the state forcing these children in school to take a COVID-19 vaccine. I don't think anybody here would say that's a good thing to do. Nobody's pushing that. But if you push the teacher to get it, then what you're saying is the sovereignty of the student is more important than the sovereignty of the teacher. It's the same thing in corrections. You got 23,000 inmates in 14 penitentiaries in this state. The Department of Corrections would never think of forcing a vaccine on all those inmates, but you want to force it on the corrections officers that work in the same institution with them. And therefore, the sovereignty of the inmate far outweighs the individual sovereignty of the corrections officer. I think it's unjust. And when you get to the next amendment, after I've argued about that, there's a couple of points I want to make on that. But I think this is an unfriendly amendment, and I hope you vote against it.
Chairman Kumar.
Thank you. Mr. Sponsor, you're extracting things out of this amendment that are not intended. It's not intended to split the sovereignty between various populations. I think everybody needs to be properly protected. And again, the purpose of the amendment completely is to protect people, protect public, protect or avoid the spread of the virus. Thank you, Mr. Chairman.
Leader Gant, you're recognized.
Thank you, Mr. Chairman. If we're going to require somebody to be vaccinated and they say, no, I do not want to be vaccinated, what happens to that employee?
Chairman Kumar, is your amendment?
Sure. I would think that employee will be subject to the rules, regulations, and processes within the entity that they work for. I'm sure they will be. And certainly, the employees need to be protected, public needs to be protected, and maybe they will be moved to another position, or in certain instances, yes, if they choose to exercise their liberty to that degree, they may need to be willing to take the consequences, whichever their department has. That's what I would think.
Leader Gant?
So what we're saying is there is a good possibility that that employee has an opportunity to lose their job, their career.
Chairman Kumar?
Or they can be repositioned to protect the public.
Leader Gant?
Is there any guarantees in that?
Chairman Kumar?
No, I don't think this legislation addresses that, but I think the guarantees will be in the procedures of the department that they work for. And when they got hired, they were aware of those.
Leader Gant?
Yeah, I would just share my sentiments, and I guess that we're all looking at this from both angles here and not really pointing the finger at anybody. We're just trying to decide what is a fair approach to this. And this really puts me in a very bad position. And so I'm thinking out loud as I talk, and I apologize to the committee, but there's some more work that needs to be done here and some more conversations that need to be made. And so I'm at the will of the committee, but I'm really struggling here with this.
Chairman Kumar?
I certainly share your thoughts, sentiment, and struggle, no doubt about it. It's not easy for any of us. And I think the sponsor of the bill also has struggled with it in the sense that carrying the flame of liberty, but at the same time, potentially putting people at risk. It's a very difficult decision for all of us, and I shared it with you. Thank you, Mr. Chairman.
Representative Clemens, you recognize?
Yeah, Mr. Chairman, thank you very much. And I just wanted to take a moment to thank the sponsor of the amendment, because there is nothing more important to me than the health and well-being of my children who just walked out of a classroom 10 minutes ago. So I appreciate the sponsor's intent for this, and I'll be supporting it. Thank you.
Any further questions on the amendment? Okay, Representative Mitchell, you recognize?
Yeah, and Mr. Chairman, I'll be quick. I think we're at the dilemma, what's more important, someone's life or job? And I'll go back to what I said in the beginning. No one's going to force anyone to take this vaccine currently. But if we go down this path of putting this on the book, we're having to address these questions right now that a lot of people in this committee don't like addressing. And sometimes you leave well enough alone. Thank you.
Chairman Halsey?
Thank you. I'd like to make a comment that I made in the subcommittee, just one piece of it. And that says that when public health becomes the highest law, it sets aside the Constitution. When public health becomes the highest law, then liberty and freedom get trampled under its boots. And by the way, that's called positive law. You'll see that term first show up in the 1600s. It's what all totalitarian states are built on, is positive law. When public health becomes the highest law, it is all inclusive because everything about your life, public health deals with. When it's all inclusive, then it's unlimited. And when it's unlimited, the state is unlimited. And here's the crux of all of it to me. It becomes omnicompetent. It's all inclusive. It's unlimited. And we quote Romans 13 around here a lot about what the responsibility of government is. If you go exegete that correctly, government's focus, according to Romans 13, is we're supposed to point people to good, and we're supposed to promote good, and we're supposed to praise good. The other form, or the other branch of what we're supposed to do, is to be a terror to those who commit evil. When public health becomes the highest law, the Constitution gets set aside. And then government, their responsibility is no longer to control evil, but their responsibility controls all men. And to me, that is the issue that we are dealing with, is that I can read you, you've read this, you got this in your office. You look at the Tennessee Constitution, it says at the very first thing, all power is inherent in the people. Section 3 says, no human authority can in any case whatever control or interfere with the rights of conscience. You turn 2 pages over and it tells about the geographical area of the state of Tennessee. It's pretty lengthy, but sandwiched right in the middle of it, it says people have the right of exercising sovereignty. So the issue comes, who's sovereign over man or woman's body? To me, that's the issue.
Chairman Kumar, would you like to respond?
Thank you, Mr. Chairman. Chairman Halsey, you paint a very extreme picture as if the choice is between giving up sovereignty on the one hand and there being no other alternative, in the sense that I think it's possible. If you read the Constitution, it is also where it is the government that secures the right to life, liberty, and the pursuit of happiness. Life does come before liberty in that narrative. And I don't think that means that we ignore liberty or put liberty number 2. I think would be a judicious thing to use constitutional prerogatives in a wise way so that life is first and secured and liberty there, so people should live so they can enjoy the liberty. And I think there is a balance that needs to be reached. And I'm grateful to you. You have made us think of big things, and thank you for doing so. But once again, life, liberty, and pursuit of happiness, life came first. And in that sense, we must preserve life so people can enjoy liberty. Thank you, Mr. Chairman.
Thank you. Chairman Williams.
So much talk of liberty and safety. I'm reminded of Ben Franklin saying, he who would purchase a little essential liberty deserves neither safety or liberty. We just had a discussion about how some of us came in here to adopt an amendment, me being one of them, that was much broader drafted than we expected it to be, was very close as it related to the actual amendatory language, of which I think the body could get more comfortable with if it were more narrowly drawn. When I look at where we are, and we've got a few minutes left, we've got a controversial amendment in front of us as well. The role of this body, as my colleague from Nashville said a minute ago, is to deal with the health of the people. And because of that, and because I believe this is a process that needs not hurry, and we have a full calendar, Chairman, I'd make a motion that we roll this bill a week.
Proper motion, proper seconded. Any objections? Any objections? You have a question.
So the one amendment that we have voted on already, does that carry over the roll?
Yes, so we pick it up in the same posture.
Okay. No objection. Okay.
Chairman Williams.
Just for a legal clarification here, the point being, we would have to rescind our actions to remove the previous amendment off unless we could communicate with enough members of the body to pull it off and put some narrowly drawn amendment back on there. So, Chairman, if I'm correct, then this body would come back directly to where this bill is. It's not an adjournment. We're rolling a week. We got more bills to get to. But when we did get back to this bill at the next week, we just pick up where we are now.
That'd be correct. Without objection, we are voting to roll the bill 1 week. All those in favor say aye. Aye. Opposed? Ayes have it. The House Bill 13 will be rolled 1 week.
Thank you, Committee and Chairman.
All right, that brings us to 5, House Joint Resolution 4 by Representative Lamar. You have a motion, a second. You're recognized.
Thank you, Mr. Chairman and Committee. House Joint Resolution 4 is a resolution about doulas. The goal of this legislation is to clarify the role of a doula. A doula is a trained non-medical person who provides non-clinical emotional, physical, and informational support before, during, after labor and birth. Doulas are necessary and impactful members of the childbirth team whose presence can have a positive impact on maternal and infant mortality in Tennessee. Doulas are vital birth and community health workers and will be necessary to combat Tennessee's infant and maternal mortality crisis.
All right, any questions? Okay, Representative Freeman? Question has been called on the resolution. All those in favor of House Joint Resolution 4, say aye. Aye. Opposed? Ayes have it. We are on, you are on to calendar and rules.
Thank you so much, committee.
Okay. Do we have Representative Ramsey? You are recognized on House Bill 183. Okay, you have a motion, a second.
And thank you, Mr. Chairman. This bill has an amendment proposed for it, which I find to be very supportive. So I'd be glad to discuss the bill first, and we can do the amendment, or
let's put the amendment on.
okay.
Okay.
And I think it's 4179, which actually
We have two amendments on this. One, change the date, is 3697. Let's get that amendment on there first.
What?
Is that correct?
Okay, I think the 4179 accomplishes that. It has the date change in it as well.
It does not.
Oh, okay, that's fine.
Yeah, 4179 does not have the change of date
Okay,
on that.
that's fine.
So let's get 3697 on there. Motion, second. Okay. Any discussion on that amendment? All those in favor say aye. Opposed? Ayes have it. Okay, we have a second amendment, 4179. That is a friendly amendment.
Yes, sir. Yes,
Okay.
sir.
You have a motion and a second. We want to discuss that. Are we good with that?
I'm good with it. Yes,
Okay.
sir.
Any discussion? Okay. All those in favor say aye. Okay. Opposed? Ayes have it. 4179 is now on the bill. You can discuss the bill as amended.
Okay, thank you. And the with the application of both of those amendments, this bill addresses only licensed professional art therapists. That's what the amendment did. One specific label. After World War I, it was found that art was very effective in communicating with children, adults, seniors suffering from trauma and brain injuries, and anyone that lacked communication skills. In 1942, the practice of art was combined with therapy, psychotherapy, and was standardized. And in 1994, the Art Therapy Certification Board began national credentialing for art therapy board certification. And this bill is what it does is adopts a state license for what the federal, the national board already has credentials as certified licensed, or pardon me, professional art therapist. So what this bill will do is it will increase access to affordable, quality mental health care. The providers in the state of Tennessee with a positive fiscal note, and do so while generating revenue. The close of 2020, we heard only bills that had COVID relief in them, but there was no bills that addressed mental illness coverage. And I'm told by our largest mental health counseling provider in the eastern region that counselors are not going into counseling as much. It's been a long time since they got any increases in salary, and so we're not getting as many in school as we used to. And over our lifetime, 1 in 4 of Tennessee citizens will be deemed as having a mental health issue. The government's provided new budgetary support for mental health, but the funding is not within TennCare, which typically, I'm told by our providers, is 50 to 80% of the counseling that they do. So the art therapists are a master's level mental health profession who have specialized in education and training to effectively work with all ages, a wide range of mental health needs, PTSD, schizophrenia, cancer, abuse, national disaster. And art therapy profession has been heavily researched and found to be so effective that the Department of Defense employs art therapists. We have an art therapy program from the Department of Veterans in Clarksville. And Second Lady Karen Pence actually visited that facility because in 2017, she adopted art therapy as her signature cause as Second Lady in the White House. She calls it the Healing with Heart Initiative. It's been very successful, and the success is a great opportunity for Tennessee. MTSU, as of next fall, is planning on starting an art therapy program for the master's degree. And due to the interest of the students in the state, we have 7 schools of higher education that have undergraduate programs that prepare. Yes, sir.
You need to be recognized. So we're not, but if with the sponsor's indulgence, I will recognize who called the question. Leader Grant, you're recognized.
Thank you, sponsor. Great explanation. And but question on the bill.
Okay. Do we have any objection? Okay. Seeing none, we are voting on House Bill 183 as amended. All those in favor say aye. Opposed? Ayes have it. Bill moves on to government operations.
Thank you, ladies and gentlemen,
Okay.
especially Chairman Leatherwood.
Yeah. All right, so,
no, I'm sorry,
Gant.
Chairman Gant. But I love you too, Tom. But
All right, thank you. We still have calendar, and all those bills that we did not get to will be rolled to next week without objection. It does not count as one of the 3 calendared times that they have been calendared. So without objection, we are adjourned.